Hello and welcome to A Closer Look. I'm Crystal Park. Today we're discussing mental health in the Asian American community. Mental health is often regarded as secondary to physical health, even though it can originate from physical imbalances. This mentality is even more pervasive in Asian societies who place a heavy stigma on those who suffer from mental disorders. According to the first national study on rates of mental illness in Asian Americans conducted in 2003, Asian Americans are 3 times less likely to seek help than whites. One of the major reasons for this disparity is the overall attitude towards mental illness in Asian culture. It's considered noble and strong to internalize mental struggles, while it's seen as weak to admit to mental health problems. This makes it hard for those who suffer from mental illness to seek out and obtain treatment. To shine some light on this complex issue, we're joined by Kate Liu, a social worker with the Chinese Community Service Center, as well as Chi Young-suk, the mental health coordinator for the Korean Community Service Center, and last but not least, Uma Alawalia, the director of Montgomery County's Department of Health and Human Services. Thank you all so much for joining me today.
Thank you for inviting us.
Thank you for having us.
Well, as you all know very well, this is a very complex issue, and it really begins with some cultural attitudes that are blocking a lot of Asian Americans from getting the mental help that they need. Kate, can you explain to us a little bit about this cultural barrier and how it is that mental health is regarded in the Asian American community?
So, like you mentioned, mental illness is always associated with personal weakness, and the Chinese culture or the Asian culture emphasizes a lot on resilience or keep it down and not bring any trouble to anybody in the society. So oftentimes people just like retreat to their quiet place and hopefully to get over the difficulties or difficult time.
And as we know, the Asian community is a diverse one. It's not just one monolithic group. And Chi Young, you are a mental health coordinator with the Korean Community Service Center. What are some of the differences that you have seen personally in your work, the differences between even the Chinese community and the Korean community when it comes to attitudes towards mental health?
It's considered as taboo, like it's similarity we have with the Chinese community. So people are afraid of talk about it and they're afraid to share what they are going through. So that's added another barrier to getting a treatment to the services available in the community. So that's the one biggest barrier we have.
And you know, just because Asian Americans don't seek out mental health does not mean that they suffer any less from mental health issues. Kate, do you know of any statistics or numbers about the rates of Asian Americans who suffer from a mental illness compared to their other counterparts?
Right. So I did some research. Actually, the rate for like people suffering from it is hard to get because people are hiding; they won't come out. But we do have some statistic on how many people, the percentage of people who go out and seek help, and I got some quite alarming numbers. So for white adults, it's about 16.7% of the general population would go out and seek help, and for the next one would be the American Indian and Alaska Native, and then followed by the Black African American, and then Hispanic, and then Asian. Asian is 4.9, so it's like, you're right, it's 3 times less likely they will go out and seek help.
Uma, you know, you as the Director of Health and Human Services for the county, does the county have resources that recognize the specific cultural limitations that face the Asian American community when it comes to mental health?
Sure. So as you know, you've been talking about some data, and I think it's stunning that females, you know, among females of all racial backgrounds, the highest suicide rate between the ages of 65 and 85 is with Asian females. So it really speaks to a significant issue, a barrier for people to come out. We have very significant outreach and educational efforts that happen through our Asian American Health Initiative. We have health promoters who are going out, we're knocking on doors, we're putting out materials, trying to reach into the community, particularly encouraging people to seek help. So I think we're recognizing it as an issue, and in the department we certainly have dedicated resources. And we work with our partners, so it's not all within the department. We have many nonprofit partners like, where Kate is and at the Korean Community Services Center. So we partner together so that, as you said, we're not a monolithic group. Asians aren't just one group of individuals who speak one language and with the same cultural norms. And so the more culturally responsive we are, the more likely it is that people will pay attention to the messages that we want to deliver.
And one of the ways to be more culturally sensitive is obviously to offer services in one's own native language. Chi-young, do you find that offering services in Korean, for instance, does that make potential clients more likely to come and seek help from you?
Yeah, definitely. Like they are. I'm sorry. So definitely, that it's has a lot of benefits to have the ethnic specific services. So people definitely they have difficulties finding services. First one is the language, so that lowers the barrier that when they search for the services. Even though we don't have services in our side, we can share the referral sources, so we can connect them to the sources they need. And actually, so in the another office I work, it's in the Montgomery County, but then we have the psychiatric service in our building, so that makes the in-house referral service available. So that's really good service we have. So when we have counseling clients who need the more intense care, we can refer them to the psychiatric service.
Well, Kate, as you are familiar with, it's a task in itself to get people to come and seek help. But there's another barrier. Once they do seek help, many times clients bail treatment before it's completed. Why is that, and how do you combat that?
Right. So I think that's very normal. People just show up once, talk about the issue, and then they disappear. And I think one of the reasons is that the cost for the treatment and a lack of understanding what mental health services deliver in American society. That's another issue. And I would think that also putting priority in your life is another huge factor. Because Asian people are pretty practical. They deal with the crisis or the most urgent needs at the top, and maybe they need to bring the children to the school first and just achieve whatever they set in their list first. Maybe dealing with your emotional or your feeling is not as pressing as all the tasks is right there. So I think that's another issue.
Uma, you mentioned the Asian American Health Initiative, a very important part of the county's outreach to the Asian American community. Is the county able to attract the type of workers who can reach the Asian community either through their own language or cultural sensitivity? How does the county make sure that their workforce is full with people who can be culturally sensitive to this particular group?
So that's a tough issue. We actually have a shortage of workforce who are culturally responsive to the Asian communities. There's a shortage of workers for other cultural communities as well. Mental health is not a profession that generally immigrants seek. I think tend to be engineers and doctors and computer scientists and researchers, and not always thinking about social work or mental health professionals. That was interesting. I was at the University of Maryland School of Social Work maybe 6 months, a year ago. And in that room, I asked the question, how many of you are second language speakers? And 3/4 of the room raised their hands. I actually do think that this issue is going to right itself in another 5 years. We're not going to have the same shortage of professionals, but at the moment, they're much in demand between the public sector and the private sector. So when we recruit, we partner with all of the universities and the academic centers to look for social workers and therapists. We We have a language differential that we pay if people are willing to provide interpretation services, language access services, even if it is not in their own line of work, but somewhere in the department, if they can be helpful. We translate a lot of material, and we teach our staff to use the language line, and we have our health promoters and the Asian American Health Initiative staff, and then we call upon our nonprofits to help as well when needed, to do some of that. You know, even if you only have an English-speaking therapist, then we can have interpretation. It's not the most effective. The most effective is when you can speak the language and you have some of the cultural connectivity. That is so important. So we just need to keep beating the bushes. We need to, create in the minds of our young people who are coming into the workforce that this is really important work. It's good work. It's satisfying work. It pays, a good wage, and continue to do that. I don't think we're there yet.
Well, this question is really for the whole panel here. We're talking about the work that you all are doing within the Asian American community, but as we know, there is a larger community out there. The statistic, but whites seek out help 3 times more than Asian Americans. So what do you think that the overall mental health community can do to help the Asian American community to try to break down some of these barriers? Kate, I'll start with you.
Right, so I think first of all to admit that actually Asian or Chinese or Asian are not the model minorities. We do have our problem, especially for immigrants. There are so many, the whole environment change, a lot of stresses in life. So we do have a lot of need that we need to help the society to realize that.
That's an important point here about the myth of the model minority, which can prevent a lot of people from seeking out help because of that whole mentality of this is going to be seen as weak. So that can be quite harmful. Chi-Young, same question to you. What can the mental health community at large do to try and help the Asian American community break down the barriers?
I think the education is really important because as I grew up, we are not learned or educated about what mental health and then how we can approach, and then we actually haven't heard about what we need to do when it happens to us. So we don't know. So it's for us. Community at large, we need to educate them and the research educate them, and so how they can.
Well, education is very important because that's part of just raising awareness, and as long as people know that A, it's okay to seek help, and B, the part that Uma's talking about, that there is help that they can get, that's going to be significant in breaking down these barriers. And lastly to you, Uma, how can the Department of Health and Human Services at large help this subset of Asian Americans who need mental health?
So we've done a lot of things, and I do want to call out, we have this thing called a photo novel that was done last year, and it's actually translated into 6 languages, and it encourages people to seek help. And then we also did a mental health video. We've done mental health first aid trainings around the county and at schools, at different locations. And so we really want to use these tools to create awareness, right? And for everybody to use them out in the community. In addition, we're actually now working on the next photo novel that's about getting care. What's the role of a therapist? Why is it important to finish a course of treatment? What's involved in the process? That confidentiality and privacy are extremely well respected. I think it's important to say that mental health is, while it's an acute problem in the Asian American community, it isn't as though we have more than adequate resources for all communities who are experiencing mental health issues. There is a stigma and a taboo attached to it. There aren't adequate treatment resources. So the advocacy is further complicated, I think, and the access is further complicated in the Asian community by the diversity, the language access, the cultural barriers, the perception that somehow you're weak if you're not accessing. And you know, as a community, as the Department of Health and Human Services, we have a particular obligation to make sure that we're lifting this issue up.
Absolutely.
We're advocating for it. We're providing a whole bunch of resources. And all of the programs and services have a very robust continuum, that there is a place there for language access and for interpretation services and treatment of Asian Americans.
Well, thank you all so much. You are doing very important work. Thank you so much for joining me today. Our guests today were Kate Liu from the Chinese Community Service Center, Ji Young Suk from the Korean Community Service Center, and Uma Alawalia from the county's Department of Health and Human Services. That's been a closer look on mental health in the Asian American community.